The patient has a fifth metacarpal shaft fracture. I am making an ulnar gutter metacarpal fracture brace, which places the patient's wrist in slight extension and the metacarpals in 70 to 90 degrees of flexion. As you can see, I've made my outline and I've included the ring finger. So we're going to put the material on, forming it to her arm. Then we want her metacarpals in 70 to 90 degrees of flexion. So I'm going to gently pull them into where I want them. Keeping in mind to make sure the materials flush against her skin, asking her if it's too hot or if it's okay. The ulnar styloid can be a point of pressure with this splint, so often I will put a thin layer of putty over that area and then mold the splint on. Now that I know I need to cut off, go ahead. Just gonna cut along where I made my marks. I'm cutting it out. We're going to return to the hydroculator and smooth out the edges. So I dip just my edges in there in the hot water. And then I use my palm to smooth out the edges and make sure nothing is sharp. So we've tried it back onto the patient, and you just want to make sure, definitely sometimes the small finger PIP is obviously lower than the ring finger. So we want to make sure that she has enough room to perform her exercises. So I know that I need to make a little bit more cuts there. I want to make sure everything else fits good. I'll ask the patient again, how does this feel so far? Feels good. And then now I'll bring it back to the hydroculator and make that cut. Okay, so we're gonna put on an underlayer underneath the splint. Side. Place it over the patient's arm, putting the thumb in there. Making sure it's smooth and there's no bunches or any of the material bunching up underneath the splint. So then I'm going to put the splint on. We want to look for a couple things here. That it's nice and flush and there's not too many gapes or holes or anything, but again, it can't be too tight. Right along there. I tend to use the soft strap right around the palmar area here. Patient, how does it feel? Is it too tight? Is it hurting you anywhere?
No, feels good.
Then they give them instructions for washing. So to remove it, wash it with gentle soap and water, but not hot water because you can change the shape of the splint. I give them extra undersleeves so they can change them, and then tell them that they can hand wash these if needed. And then I tend to give extra straps too, because they're going to have this on for up to 4 weeks. So I'll give them extra straps and a couple of extra pieces of Velcro, just in case they have any problems. But I also instruct them that to contact me if there's any problems, if it's hurting them anywhere, if they develop any red spots, if it's too tight, if it's too loose. Also contact me if the swelling decreases and they need it adjusted. Okay, the good, the bad, and the ugly with this splint. So we want to include the 4th digit because she fractured the 5th metacarpal here, and I only go up to the base of the PIP joint so that she can exercise and move her fingers. You want to make sure that the splint is secure, and especially secure and tight in here in this area because that's where she needs the most support. You want to make sure it's not too tight where it's pinching her or anything, and then you want to make sure all the edges are smooth so that she doesn't get any skin irritation or any kind of pressure points throughout the splint. That's it. Thank you for watching my video.